It's time to switch gears now to our Wellness Central. And today we'll be commemorating World Skin Health Day 2024, a day dedicated to raising awareness about the importance of skin health and the impact it has on our overall well-being. Now, skin health is crucial, not just for appearance, but also for protecting our bodies from external harm.
Hear, hear. Now, on this World Skin Health Day, we aim to highlight the importance of taking care of our skin and provide valuable tips on how to do so effectively. So joining us is Dr. Folakemi Cole-Adeife, Consultant Physician and Dermatologist, Lagos State University Teaching Hospital, who's going to help us understand more about skincare, answer some common questions on maintaining healthy skin, and address common skin issues. Welcome, Dr. Folakemi.
Hello, I'm very happy to be on the show this morning.
Thank you very much.
So, would like to know, what are some daily habits everyone should adopt to maintain healthy skin? I don't know if this is a question for me. I'm playing devil's advocate here. I think I have very good skin already. But, doctor, do tell us what daily habits we should have.
Great. Yes, your skin is, well, the skin is the largest organ in the body. It's what represents us. It's what everybody sees. So it's like our ambassador. It's our passport. And there's a lot of importance to maintaining a healthy skin. The skin is also a window into the body. So if you're not healthy inside, it's most likely going to reflect on your skin. As a dermatologist, if I look at a person's skin, I can actually make diagnosis of some internal conditions based on what their skin looks like. And there are many ways to take care of your skin, but the basics are, first, it starts from within. What you eat, what you put into your body. Make sure that you eat a healthy diet with fruits, vegetables, lots of water, and avoid things that are enemies of the skin in quote, like sugar, too much of sugar, then of course the alcohol and cigarettes. All those things reduce your skin's health and the quality of your skin. You also want to make sure that you use the right skincare products. Avoid skin lightening agents, skin bleaching creams, and use gentle moisturizers, gentle soaps, and also make sure that you don't overdo it with antiseptics. You make sure that you use a sun protecting cream or a sunscreen, and also you want to make sure that you have regular skin checks. Sleep is important for your skin. It's not called beauty sleep for nothing. And also you want to make sure that you avoid unnecessary stress.
Well,
in today's world, the climate and pollution is also having a negative impact on the skin. And in Nigeria, we suffer from that a lot because of, generator fumes and things like that. So you want to make sure you avoid as much pollution and fumes on your skin as possible. These are a few things that can help you to maintain a healthy skin.
Dr. Folake, you said avoid unnecessary stress, and I just want to say that to Lagos traffic. Anyway, but many people...
That's why I said as much as possible.
Yeah, I don't know how possible that is.
It's not totally in your hands.
But away from that, right, let's get serious a bit and talk about specific skin issues. There's some people who battle with, eczema and acne and psoriasis and, dry skin. What are some general advice can you give to those dealing with very common skin issues like eczema and acne and psoriasis that we see normally?
Yes, skin problems or skin diseases are actually very common. One of the top 4 things that patients present with in the hospital or in the clinic. They won't kill you in most cases, so people don't really take them seriously. But a lot of people who battle with these conditions you mentioned, they suffer a major it negatively affects their quality of life. They have social and economic issues. So yes, treating them is extremely important, and people shouldn't downplay the role of treating your skin. The first step is to see an expert, a dermatologist. A dermatologist are not just a skin specialist that claims to be a skin specialist on the internet, because we have so many of those these days. You want to see a board-certified dermatologist who has trained in skin dermatology, the skin, the hair, the nails, and the mucous membranes. The dermatologist will be able to assess your skin and determine the best form of treatment to minimize the burden that these diseases may cause or these skin problems may cause. With acne, there are many different types of acne. So depending on the severity of acne, you may require topical medications, and sometimes you may require oral medications. So it's a dermatologist that will be able to advise you, hey, this is mild acne, you do well with just these topical agents, a good gentle soap-free cleanser, some antibiotics, topical antibiotics, a retinoid. These are things that a dermatologist would recommend. So I would say for people who have skin concerns, see a dermatologist because the presentation can vary and it's only the expert that will be able to guide you appropriately on how to go about taking care of it with the least amount of complications and, of course, effect on your quality of life and psyche as possible.
Right.
I'm going to come to you on something you said. You talked about stress being a factor for our health of our skin. I don't exactly know how stress can be a factor. I'm under stress now, but I don't think it's showing. Is it showing, Judith?
It is now.
Is it showing? But tell us how stress can affect our skin.
Most things because of chronic stress. For instance, when people are stressed, you secrete a hormone called cortisol. And cortisol, the hormone called cortisol, can interact with the skin, can lead to an exacerbation. If you already have a skin problem, it can make it worse.
Okay.
That's the secretion of cortisol and other hormones. And then cortisol is known to be associated with darkening of the skin. So sometimes that's why you see when people are really stressed out, in addition to sun exposure, because two things that make us a bit darker is sun exposure and then sometimes stress. So the stress can actually lead a person to get slightly darker.
That's very interesting.
For people who are, so for people who have things like psoriasis, atopic dermatitis, acne, it is known very well that this stress aggravates these conditions.
But doctor, what about
like I
product?
said, the skin is...
Sorry?
What
about product, the kind of product that we put on our skin? And many people would say, oh, my skin is getting darker, I might need a lightening agent. You also spoke about bleaching agents as well. How much damage are we doing to our skin trying to help it out in the first place?
Yes, so the problem is that bleaching is not the solution. Why are you getting darker? We look for the underlying causes and manage them. For most people, it's sun exposure. UV exposure, UV radiations from the sun actually trigger the melanocytes, the cells that make the color, the melanin in our skin, to produce more. So when you're exposed to the sun, you get darker. And that's one of the reasons why most people, the parts of your body that are covered by clothing tend to be lighter than the parts that are exposed, like the face and the hands. So that's where we always recommend people to try to use sunscreen more frequently for the parts of the body exposed and have sun-safe or sun protection practices like using, a hat, a wide brim hat, wearing clothing when it's very hot that cover the body, that are light, using an umbrella, particularly for people with albinism. We recommend they use umbrellas to go out during the day because they don't have any melanin at all. So those kind of things can help to minimize tanning, which is what happens when we get darker. So that's one way. But skin lightening agents usually will damage the skin. Most of them contain chemicals that are harmful in the long run. Initially, you may look very nice, but the problems are coming, in the future. Just like smoking or cigarettes, smoking cigarettes or taking alcohol, the problems don't start immediately. It's a few years down the line that they begin to show up. And it's the same with skin lightening agents. Not only do they affect the skin, they can also affect internal organs because some of them are absorbed into the bloodstream and can lead to problems like hypertension, diabetes, can lead to hormonal imbalance and several other concerns, that we may have kidney failure and all of that. So it's very important that we try to avoid lightening the skin the wrong way. Also, if you do all the basics, like I mentioned, eating a healthy diet, drinking lots of water, reducing sun exposure, wearing sunscreen, your skin will not get darker. Your skin will just be like the normal color it's meant to be. But some people want their skin to be much lighter than what God has given to them.
Well, would you blame them? It's our social conditioning and our affinity for white or light things, or
yes.
I know where she's going, but
dark skin, black is beautiful.
It is
Of course, it is
indeed.
beautiful indeed. I mean, you just debunked some common misconceptions that we have about skincare. So, wear your sunscreen. Not all sun exposure oftentimes can be bad. Also, protect yourself from the sun. Lightening agents can be good, but it depends on your dosing and the type of lightening agents that you're using. But also, I would also like to talk about another misconception that Mazzino has about makeup.
Can I approach the bench? I'd like to approach the bench.
No.
While you were talking and while we had the camera on you, I asked Judith, what about makeup? How much makeup becomes, is there a stage where it becomes detrimental to your skin? I'm asking professionally because, well, every day, well, she puts on makeup, I don't. I'm naturally like this.
Liar!
Can makeup damage your skin, especially when you have to use it every single day? I'm concerned.
Well, yes, I think I'm a fan of moderation. So a little bit of makeup to enhance your beauty is not a bad thing. But the problem comes where it's too thick, we're using it too much, and then the hygiene practices of applying makeup. So there are some kinds of makeup that are known to be comedogenic, meaning that they can result in they can worsen acne or cause acne or breakouts. And, you want to use less of those non-comedogenic makeup. Also, you want to make sure that before applying makeup, the brushes and everything you're using are hygienically cleaned, because there have been cases of transfer of infections from makeup brushes and makeup applicators. So that's also important. But I will always say too much of almost anything is bad, except the love of God. So too much of makeup is also, bad for the skin and can lead to a myriad of issues on the skin: irritants, dermatitis, acne breakouts, and, things like that. So you want to be moderate with makeup.
I'm glad you said this, because now it has validated why I double cleanse every night. I cleanse and then I cleanse again.
So with that double cleansing, yes, you don't want to overdo it.
There you go, Judy. You should have said
Wait, first.
But when you do wear heavy makeup, yes, it's advised.
Yeah, so television is quite heavy, so I go in with an oil cleanser, then a normal cleanser, and then follow with my toner and my serums and my moisturizer.
Yes, but
my
not too many things.
cream.
So we're having this myriad of people using too many skincare products that can damage your skin barrier. So just keep it simple.
Right.
And I want to add that, in addition to this, we also want to use this World Skin Health Day to address the fact that a lot of people lack dermatological care. Over 3 billion people worldwide do not have access to dermatological care, or they have to wait years, or there's no dermatologist, in their area. In parts of the world, in Nigeria, we have one dermatologist to 1 million people. And, beyond the beauty, people actually have serious dermatological conditions that cause disability and that that affects their economic prospects and opportunities. And we are using this opportunity to raise awareness that, we need to have more access to dermatological care. Like I mentioned, because the skin problems are not fatal, most times they are overlooked, but they are very, very important, particularly for people's quality of life. And we need to raise awareness to encourage our governments, our people to invest more in access to good skincare, dermatological care to be made available in hospitals, in clinics, to be put on, the health insurance schemes and all that, because 1 in 4 people or 1 in 5 people that come to a clinic usually come with a skin problem. So the skin problems are actually quite common, but often overlooked. And we really need there to be more awareness about the importance of dermatological care, not just the beauty aspect of it, but the medical conditions, like what you're showing. This is vitiligo, this is acne, this is psoriasis. And we see these conditions on a day-to-day basis in our clinics. And we hope that, in areas where there are no dermatologists, we'll be able to partner with general practitioners to be able to manage such cases and increase knowledge on how to treat skin conditions in these areas.
Well, Doctor, we want to say a very big thank you. Thank you so much for coming on and sharing your professional insights as we commemorate World Skin Health Day 2024. Thank you so much, Dr. Folakemi Cole-Adeife.
Thank you. And I love both of your skin. You look amazing, by the way.
And we try. You know what I mean? Mazina's one is television. Mine is Clara.
Thank you.
Thank you.
Tonight, when I take off my mascara, I will remember everything that you have told us. So, thank you very much, Doctor. Bye-bye.
All right. Have a beautiful day.